VEXAS syndrome is a rare autoimmune disorder that mostly affects men over 50. It can cause blood problems, fever, and inflammation that can lead to organ damage. VEXAS syndrome was first identified in 2020, and it is estimated to affect approximately 1 in 100,000 men. What causes VEXAS syndrome? VEXAS syndrome is caused by a mutation in the UBA1 gene, which is located on the X chromosome. This means that VEXAS syndrome is more common in men, as they only have one X chromosome. Women have two X chromosomes, so if they have a mutation in the UBA1 gene on one X chromosome, they will usually have a normal copy of the gene on the other X chromosome. What are the symptoms of VEXAS syndrome? The symptoms of VEXAS syndrome can vary from person to person, and they can range from mild to severe. Some of the most common symptoms include fever, fatigue, shortness of breath, cough, chest pain, skin rash, joint pain, muscle aches, swollen lymph nodes, blood problems, such as anemia, thrombocytopenia, and neutropenia, organ damage, such as lung damage, heart damage, and kidney damage. How is VEXAS syndrome diagnosed? VEXAS syndrome can be difficult to diagnose, as the symptoms can be similar to other conditions, such as infection, cancer, and other autoimmune disorders. To diagnose VEXAS syndrome, doctors will typically perform a physical examination, review the patient's medical history, and order blood tests and other imaging tests. A blood test can be used to detect the mutation in the UBA1 gene that causes VEXAS syndrome. However, not everyone with VEXAS syndrome will have a positive blood test. In some cases, doctors may need to perform a bone marrow biopsy to diagnose VEXAS syndrome. How is VEXAS syndrome treated? There is no cure for VEXAS syndrome, but there are treatments available that can help to manage the symptoms and improve the quality of life for people with VEXAS syndrome. Some of the most common treatments for VEXAS syndrome include anti-inflammatory medications. Anti-inflammatory medications, such as corticosteroids and nonsteroidal anti-inflammatory drugs, NSAIDs, can help to reduce inflammation and improve symptoms. Immunosuppressant medications. Immunosuppressant medications can weaken the immune system and reduce the body's attack on its own tissues. Immunosuppressant medications are often used to treat severe cases of VEXAS syndrome. Blood transfusions. Blood transfusions may be needed to treat blood problems, such as anemia and thrombocytopenia. Stem cell transplantation. Stem cell transplantation is a procedure that can be used to replace the patient's diseased stem cells with healthy stem cells. Stem cell transplantation is a last resort treatment for VEXAS syndrome, and it is typically only used for patients with severe disease. Living with VEXAS syndrome. Living with VEXAS syndrome can be challenging, but there are things that people with VEXAS syndrome can do to manage their symptoms and improve their quality of life.